Africa is in transition. There is a huge climate change going on. There is a huge urbanization going on. There is a huge population growth going on. And on top of that, there is an epidemic of antimicrobial resistance, so drugs don't work any longer. And we have no clue where the money comes from. There is a lot of reduction of funding for the health systems in Africa. So under those circumstances, we have to do more with less.
Epidemics, both non-communicable diseases and infections, are a direct attack to health systems and therefore a litmus test for their resilience. Malaria is one such major challenge. The Kisumu County Government Department of Health has faced myriad challenges in the management of malaria.
The main malaria challenge we had as a county, of course, was getting data and being able to use it at the right time to make decisions.
The knowing of how malaria is distributed in terms of gender, in terms of age group, in terms of which areas they are more concentrated. We just used to key in data from the community unit level, but we were not able to visualize or see that these are the areas that malaria is concentrated.
Patients often seek treatment without testing for malaria or do not seek help in time. When they receive the wrong drugs or no drugs at all, they get complications. Malaria data are typically collected through public healthcare providers. Private facilities are not connected. But the private sector provides almost half of all malaria services in Kenya. So there is a serious blind spot for policymakers. This needs to be addressed, for example, through connected diagnostics.
One of the challenges that we face when dealing with malaria in Kisumu is that the data is always retrospective. When we look at KHIS, which is the health information system that we use, usually community health workers and the facilities report at the end of the month. So many times you are looking at retrospective data. The second thing is that the data is very fixed because it is facility-based data. And so you can only know how many cases of malaria have been seen in that particular facility. And the third thing is that it does not include the smaller health facilities, the pharmacies that people go to.
Kisumu County has adopted a new digital approach to malaria care, which has proven that it is possible to do more with less. The Connected Diagnostics project brings malaria care closer to patients via a hub and spokes model, whereby patients are tested and treated by chemists or community health promoters and referred to private health facilities when needed. When a patient has fever, they can get tested for malaria at a private health facility, chemist, or by a community health promoter using the Health Pulse app. The photo of the malaria test results is uploaded via the app and interpreted by AI on the back end as quality control and transparency. To encourage data upload and testing before treatment, incentives are provided in the form of data bundles and digital mobile money for every correctly uploaded test. The results are displayed on a real-time geo-mapped dashboard made available to the county for malaria surveillance. Health Pulse was developed to assist frontline lay workers in testing and treating malaria or making referrals when needed. The app supports frontline workers in how to test for malaria and based on the results, treat or refer according to WHO guidelines. The data from the app is fed into a semi-real-time geo-mapped dashboard that supports policymakers in resource allocation and targeted interventions, as well as community health assistance in managing their CHP units.
I use the dashboard to monitor the activities of the CHPs, maybe based on their performance. At a glance, I can see how they are performing based on their work. Second, it also helped me to do supervision.
Our vision is that at our Public Health Emergency Operations Center, that is where we monitor diseases, that's where our disease surveillance team is. They should be able to see this information on the dashboard so that every day in the morning when they wake up, they're able to see the trends or what is going on where and where they need to intervene.
The Connected Diagnostics project has brought several benefits for both patients and frontline workers via digital decision support and to the county for disease surveillance.
As the County Minister for Health in Kisumu, this project has helped us to integrate the private, the public health sector systems. Access to data from the private sector has made us be able to get holistic view of the malaria status in a certain particular region.
Having an application that uses artificial intelligence to identify the malaria cases and to make decisions at that lower level has really helped us to be able to capture the malaria cases and use malaria case management as an intervention to be able to reach out to the communities and be able to identify malaria and be able to treat.
With the simple AI-supported app, private providers and community health promoters now test patients before they offer the correct treatment.
As a community health promoter, my main work is home visits, do the assessment, the filter tracing, doing follow-ups. In most cases, we do test malaria if the kid have fever. Medication, I will do the correct testing. They trust that I will refer them to a correct hospital where they will go for further investigations.
Nimekuwa na Jacob for 3 years now. Amekuwa amenisaidia, akanihudumia. Nikikuwa na malaria namuita, anakuja ananitest. Kitambo nilikuwa natembea nikienda huko na hospitali. Nikienda huko naweza panga line nimalize the whole day huko OC. Na hapa akikuja ananifanyia haraka ananimaliza na nitibu, ananipea dawa haraka. Kama ni kitu ya kunirifa, ananiambia enda hiyo OC. Huko nikienda nafanyiwa huduma haraka juu Jacob amejulikana huko. Nikienda na referral, wanapita hata wenye wako mbele, wananihudumia juu kuna referral. Imenisaidia kabisa juu saa zingine naweza kosa transport ya kwenda huko. Na yeye nikimtaji anakuja haraka ananihudumia.
The impact I've seen since I started using the app in the community is that right now, whenever there's any signs and symptoms of malaria, I'm normally being called to go and do assessment. The issues of time wasted going to the facility are no longer there.
At Russian Pharmacy, we do dispense, we test for malaria, at the same time we advise further. We can also do referral.
First of all, they did some testing. So they pricked my finger, took a blood sample, and they were able to do like a litmus test. They also prescribed the drugs once they figured out that I have malaria for me to like go take at home.
Around this area, most of the patients have recognized that we are doing the good work, so the influx of patients has increased.
The fact that they are able to test and treat you without having to go to a hospital, that's like a big plus from me.
I've realized that most of the patients are coming to ask for the test themselves instead of me requesting them to do the test. At the pharmacy, right now we can do the quality testing and accurately.
Tungeweza kufanya dispensing over the counter, unaweza kutibu mtu bila kutest. But tangu project ikam, unaweza convince mtu ule amekuja kununua tu dawa, unaweza mconvince afanye test, at least tunatibu kitu tuko sure nayo. After hii app ilikuwa introduced, tulipelekwa training twice. Actually hapo ndo nilikuwa train sana kupima malaria. Tulienda hiyo through the process ya kutrain, tulijulishwa signs za malaria, kuna zile hatukujua.
Difference nimeona since tuanze kutumia hii app Health Pulse, tumebuild trust na clients wetu, maintain customers wetu in a way that is not recurrent. The app inatusaidia kujua how many RDTs tutahitaji within a week or a month kufanya stock taking. Feedback receive from our clients kwamba ile turnaround time imekuwa reduced from 30 minutes ya microscopy to 20 minutes kwa malaria MRDTs.
An evaluation study was conducted on the feasibility and acceptability of the app.
And indeed, from the interviews that we have done with them, we realized that one, they noted that the app was easy to use. They also found it useful. They were able to test many patients, and in some sectors like the chemists, for example, we noted that through use of Health Pulse, they embraced a lot of testing rather than just relying on empirical treatment. The use of Health Pulse and the use of incentives has affected treatment accuracy in some way. Let's say you are giving some incentive to these healthcare workers. Talk about the lab techs, the CHPs, and the pharmacists. When you give them a little incentive, they are motivated to test fast. So what does this imply? This means that if they are testing fast, then they are not shooting in the dark. They are treating what they know. If a patient has malaria, for example, the RDT was positive, they know that the patient has malaria and they are giving the right molecule to cure malaria. And so in this case, I'll say accuracy of treatment has improved by a great percentage.
While Kisumu serves as a powerful example, true scale will be realized when such approaches are systematically applied to the full nation of Kenya, and preferably beyond. Epidemics do not care about borders.
We want to make sure that Kisumu is totally digitized in terms of epidemic preparedness. And it's not only about epidemic preparedness, we are doing it for the whole health system.
We want to be paperless. We want to make decisions almost daily, almost instantly. It's something that we hope that both county and the national government will embrace, so that we don't have any person dying as a result of malaria because of delayed decision making, or maybe the disease increasing because we were not able to make decisions at the right time on when to bring in interventions and how to distribute them appropriately.
This project delivered a proof of concept that this is feasible on the ground, and the next step is to expand towards epidemic preparedness.
This compelling model is ready for adoption in new contexts, as are its principles, that is, real-time digitally enabled data for better decision-making, decentralized care, and local ownership.
We used a bottom-up approach where we created a very strong professional working relation with our field team, and this translated into good results, and as a result the county were also proud, and it created some sense of ownership.
Malaria is still a huge problem. There is not a good vaccine working against malaria at the moment that can be applied to the whole population. In other words, we need radically different approaches to actually get malaria out of this world. And connected diagnostics is one of those approaches that we think can contribute to this.
Now is the time to rethink healthcare systems in Africa.
Kukua FarmTech ni kupeana huduma kwa jamii.
Kuwa CHP ni kujitolea.
This project has been digitally innovative.
Digitally empowered.
Grateful.
It's been wonderful.
Very insightful.
Amazing.
Accessible.
Quality services.
Health is well.
Real-time malaria detection is achievable.